All right, welcome back to another episode of ICU. Today we're going to be talking about vaginal estrogen, which is a topic that we touched on a little bit in this podcast before, but I wanted to have an entire episode dedicated to this topic. So I have with me today Dr. Sarah Boyles. She is a urogynecologist out of Portland, Oregon. So welcome to ICU, Sarah.
Thanks so much for having me. I'm happy to be with you here today. There are so many topics in women's health that I think women have questions about, and hormones and vaginal estrogen. I think is a really important topic that a lot of people have never really thought about before. So I'm very happy to be here.
Amazing. Is there anything you want my audience to know about you in terms of introductions?
I'm a urogynecologist. I don't know. Do you think everyone knows what a urogynecologist is? Do you want me
I
to?
mean, maybe, but go ahead, take that and run with
Okay.
it.
So, urogynecology is a newer medical subspecialty. It's been around since 2014. And for me, it means that I did my residency in obstetrics and gynecology, and then I did a fellowship in reconstructive pelvic floor surgery and medicine. And so at that point in time, there was this thought that there really weren't physicians who were taking care of the female pelvis, thinking about things that go wrong with the vagina and the uterus, but also with the bladder and with the rectum. And that's kind of how urogynecology came about. So I see a lot of patients that have bladder issues, recurrent urinary tract infections, incontinence, prolapse. I mean, pretty much anything that can go wrong in the female pelvis. Only women. There's also a tract where urologists can become urogynecologists as well. So, I mean, my kids would tell you that my specialty is all the things that people don't want to talk about, and they wish I would talk about less. Um,
That's
so that's
hilarious.
uh,
That's such
it's kind of
a.
hilarious.
You have
So
teenagers, right?
I do have teenagers, but there were
Yeah.
a couple of times when they were younger. So maybe fifth grade and in middle school where I would go in and talk about various things. And it was never gynecology. It was always like bone fractures or something. Um, and my kids would give me very specific things that I could not say. Right. So,
That
and my
checks out.
daughter, yeah, and my daughter actually told me that I could not tell anyone I was a urogynecologist, that I just had to say I was a doctor. And I said, okay, that's fine. I'll do that. So,
Oh my gosh. I could just like putting myself in my teenage shoes, like I could see myself reacting the same way.
absolutely. Right. But it's kind of a superpower of mine because my kids have to behave, right? Or I can say these things out loud to anyone that we're with, right? And they would be, even now, they would be a little bit mortified. So,
Oh my gosh, I love that. What made you want to get into this field?
it's so funny. I was just talking to someone about this yesterday. So, for me, so in medicine, right, there's something for everybody. Just depending on what your interests are and what field you want to go into. And so for me, I always knew that I wanted to do something where I was fixing a problem, right? Where people came to me, they had an issue, and there were things that I could do to fix that problem, which, makes you tend more towards surgery versus maintenance, right? Like diabetes, making sure that, you're doing all the right things. I'm not as good at maintenance. I'm better at fixing something, and it appeals to me more. And my favorite population to work with is women. I like men. I don't really like taking care of men for whatever reason. So I always knew I wanted to do something in women's health. I knew I wanted to do something where I was, fixing a problem. And this was just the perfect field for me.
I love that. All right. Well, I think that's a good transition for us to dive into this topic of vaginal estrogen. So, I have people in my audience with IC diagnosis, OAB, maybe pelvic floor dysfunction. Maybe they don't know what the heck is going on with them, but they have bladder symptoms, who probably have never heard that vaginal estrogen could potentially help their bladder. So, can you explain what it is and why it's relevant for bladder and pelvic symptoms?
Yeah. So when I see patients, the things that I know is, people come in with symptoms, right? And there is a lot of overlap between the different diagnoses that you mentioned and symptoms, right? So if you come in and you feel like you have burning with urination, there are a lot of different things that can cause that. And we all correlate our symptoms to the things that we know, right? So patients will come in a lot and they'll say, "Well, I'm having bladder infections," because they know what a bladder infection is, but they're really having pain with urination, urgency, frequency. And so when you're looking at all of these symptoms, especially, well, I mean, when you're looking at all of these symptoms, but I think it's super important before you give someone the diagnosis of IC, you need to make sure there isn't anything else kind of happening. And so women have a lot of estrogen, right? Your estrogen levels go down over time. They go down a lot more over menopause. But we have a lot of estrogen. We have a lot of estrogen receptors, and there are tissues in our body that really like estrogen. And the vagina and the bladder really like estrogen. And when the estrogen is lower, you get different symptoms. Um, and that can happen in perimenopause, that can happen in menopause. Sometimes it'll happen when you're younger. It can happen when you're breastfeeding, because breastfeeding is a time where your estrogen is low and your progesterone is high. It can help happen with different medications, particularly different forms of birth control. And when your estrogen is low, women have a lot more irritative symptoms, right? So they get a lot more frequency, they get a lot more urgency. They're more aware of kind of the bladder and the vagina. Most of the time we go about our days and we're not really thinking about that part of the body, but it's just a little irritated. And so you're thinking about it. You can also get um, you can get more urinary tract infections when your estrogen level is low. When your estrogen level is low, so estrogen, when you have a normal estrogen level, you have different bacteria in the vagina. You have lactobacilli, and so the vagina is an acidic environment. When your estrogen goes low, different bacteria move in, and so the vagina becomes less acidic. And so what that means is sometimes patients will come in with different discharge. It feels different. Sometimes patients will come in and they'll say, I have this odor. And that can just be because of the lack of estrogen and just different bacteria. It's not an infection. Just your microbiome is a little bit different, right? And a lot of times you don't necessarily know what's going on, but your body's acting a little bit differently. So, when we see patients that have those symptoms, right, and it sounds like it's because of low estrogen, because you're breastfeeding, because you're on a medication, because the timing is kind of right, or maybe you have some other symptoms that make us think about low estrogen too, we'll frequently put you on vaginal estrogen. So, vaginal estrogen helps treat these symptoms. A lot of times when we give you oral estrogen or estrogen by the patch, you don't get enough of the estrogen in the bladder, in the vagina. And vaginal estrogen is also the safest type of estrogen, because if you use it as directed to treat these symptoms, it doesn't increase your overall level of estrogen. And so it's the safest.
Hmm. Because I've
Yeah.
heard of like hormone replacement therapy. This is different
Mhm.
than that, right?
Yeah, so if we put you on vaginal estrogen, it will treat bladder and vaginal symptoms, but there's not enough that's going to get into your bloodstream to impact other symptoms.
Hmm.
So, for example, if you were someone who had a lot of hot flashes, vaginal estrogen wouldn't treat that, or unless we gave you a ton of it, right? I mean, there are different ways that you can do that. But the way that we prescribe vaginal estrogen usually would not treat that at all. And so you in that situation you might actually need oral estrogen or patch estrogen, right? So systemic estrogen, estrogen that gets in your whole body. And you might need a little bit of vaginal estrogen too if you weren't getting enough of the estrogen to those really sensitive tissues.
Okay. Got it. And who in the bladder pain or like the OAB world should be considering vaginal estrogen? And like, is there a certain time that it's right to do that?
Um, so for OAB, I think it depends. So it's timing, right? So if I have someone who comes in and, let's say they're, in their upper 40s and their OAB symptoms are new and they're starting to skip periods, then I'm thinking, yeah, your hormones are a little bit off, and then I will try vaginal estrogen in that situation, right? It's got to correlate with everything else. Um, you know, when you say pain, right? So I see there's a lot of discomfort and pain. It kind of depends on what that pain is like, right? Everybody describes their symptoms a little bit differently. And sometimes, what someone will call irritation, someone else will describe as pain. If someone came in and they were young and they didn't have any other symptoms that made me think that their estrogen was low and they weren't on any, medications that I would, worry about, or they weren't breastfeeding, I wouldn't try that person on it. But the other thing about vaginal estrogen is there's very low risk to it. And so sometimes, even if I'm not, if I'm kind of 50-50, I'll say, you know what, why don't we just try this? Let's see if this makes you better. Because, if it does, then that's great because it's such a low risk, easy thing to do.
Yeah. No, and I guess my next question is, are there different forms of vaginal estrogen? Because when I think of that, I think of like the cream that a doctor
Yeah.
gave me in the past. I forget what it was called. Was it estradiol?
It's estradiol. Estradiol is the most
Yeah.
common one. So yeah, there are different forms, and I think that's particularly important to know. So I like patients to start with the cream because if you're really having a lot of symptoms and we think it's because of low estrogen, the cream is also moisturizing. And so I think the cream just kind of gets you to normal more quickly. Um, a lot of people hate the cream, right? It's just mucky. You have to use an applicator with the cream. I mean, you can use your fingers. Some people like that, some people don't. If you're using the applicator, I think everybody, yeah, it may be everybody. Everybody hates the applicator. It's hard to clean. It just feels like it's a big pain. So you can use vaginal estrogen cream. There's also a pill that you can put in the vagina. The estrogen cream, some people find it to be really messy, and so those patients frequently like the pill better. There are also suppositories that you can use. And then the last thing, usually with vaginal estrogen, when you're just on maintenance, we'll have you use it twice a week, which is kind of horrible just because it's hard to remember to do something twice a week. There's also a ring that will emit estrogen, and that you can put in the vagina and leave it there for 3 months and then replace it. And that's something that, women can do on their own. The pricing of estrogen is different. The suppositories are generally expensive. The ring can be prohibitively expensive for people. The pill comes in a generic. The estradiol comes in a generic. So those tend to be cheaper and tend to be the ones that your insurance want you to use. So.
Okay. With the estradiol, I'm just kind of curious, can you get specific about like where people are supposed to put it?
The cream.
Yes.
Yeah. So everybody worries about getting it in the right spot, right? And I would tell you there really isn't a right spot. So if you get it in the vagina and you get it kind of midway in the vagina, then I think it's all going to absorb and you're going to be fine. There are some times where I will tell someone to specifically put it on the urethra or the vulva if they're having different symptoms. But most of the time, If you put it too low, it's going to come out, and that's a pain. But if you get it kind of halfway up, it's fine. It's going to absorb. But everybody worries about that, right? Am I getting it in the right place? Is it being distributed correctly?
I'm
Um,
imagining like a monostat type deal where it's like an applicator and you shoot it up
yeah,
there. Is that like
it's
what it is?
exactly. I mean, that's exactly what it's like,
Okay,
right?
then I can understand the argument that it is messy because I've been there.
It's totally, yeah, it's messy. And we usually tell people to do it at night, right? So that hopefully it gets absorbed while you're sleeping, but people absorb it at different rates. Sometimes they stand up in the morning and there's kind of all of this muck, and it's a little thing that is a little bit annoying for
So
sure.
is this something that you would recommend someone try daily, and then for how long would they trial it?
So usually I have patients use it daily for 2 weeks. And then after that, I have them use it twice a week. And you're going to notice a difference if you can remember it, right? And I would tell you that most people do not remember to take it consistently, just because twice a week is hard. But if you can remember to take it during that initial period, I think after 4 to 6 weeks, you're going to notice a difference.
Okay. Yeah, I was gonna ask you like what kind of results are your clients getting?
With the vaginal estrogen,
Yeah.
if their symptoms are caused, I mean, you can get resolution of your urinary tract infections. You can get resolution of, urgency, frequency, all of those OAB symptoms, right? Because you know what's causing, what symptoms you have. You don't necessarily know what's causing it.
Right.
And so, a lot of that will go away if it's because of the low estrogen. So,
Mhm. Okay.
so it's important to think about all of those things, right? Just because it sounds like OAB doesn't necessarily mean that it is OAB. And the same thing with IC, right? There are so many different things that can cause IC or contribute to IC. Um, and a lot of patients get labeled with IC when maybe it is a lack of estrogen, or it's pelvic floor muscle dysfunction. You really have to kind of think about all of those things. And I think it's hard for individuals to figure out their diagnosis, not because people aren't smart, but because we don't talk about these things, right? And it's hard to examine it. I mean, if you have a rash, you can look at it, you can figure it out, you can take pictures of it, you can Google different rashes. I mean, the female pelvis remains a little bit of a mystery to a lot of people.
Yeah. No, I'm glad you brought that up because I think that's an important conversation to have. And I think a lot of people really get stuck on like, I have IC, these are my options. And it's like, okay, but maybe there are other things that you can explore. Maybe you do have a hormone issue. Maybe something like a vaginal estrogen could really get
Yeah,
you relief and you're just maybe not hearing about it, you know?
right. Right, because we've kind of put you in this category, right? And it's important to think about all of those things, especially, if there was an easy treatment for IC, right? And we gave you that diagnosis and we knew exactly how to treat you, that would be one thing. But that's not the case. And sometimes we give patients this diagnosis, and no treatment path. And I think that's a hard thing. So, when patients come to see me with IC, I always try to step back, right? And kind of evaluate everything, just to make sure that nothing that is easier to treat was missed that could be contributing to their symptoms. And sometimes I find something, sometimes I don't find something, but I think that exercise is always really important. Um, because maybe that one thing was missed. Most patients, and a lot of physicians don't think about pelvic floor muscle dysfunction, and that can cause so many different symptoms in patients.
Oh, yeah. We've talked about that on this podcast before. I think there are a lot of doctors that are just skipping over that, not seeing the value in it. which is
Hmm.
kind of crazy to me. Or, they just, I just heard so many people come and tell me that, PT has never been mentioned to them, or like it wasn't recommended to be seen by a pelvic PT. And that's just so interesting to me.
I think it depends a little bit on where you live, right? Because, I'm in the Pacific Northwest. We have great physical therapists here, and there are a lot of great physical therapists. Um, well, that's true in Portland. Once you leave Portland, there are fewer physical therapists, and that's definitely true throughout the United States. And so you may live somewhere where that resource really isn't available. And if you're seeing PT, weekly or twice weekly, it can be really hard if you have to travel a long ways. But
Mhm.
even for me, when I see someone who comes to see me with pain and I evaluate them and I say, I really think this is all your muscles, it takes me a while to get that person to buy into that, right? Because
100%. This was me, Sarah. Like, I
yeah.
was ready to like verbally fight with a doctor in the past because I was
Oh
like,
yeah.
this is not my pelvic floor. This is my bladder. My bladder hurts. Like, I
Right.
was that person, and it took me a while to come around.
I mean, I think that's really common, right? And it's because, you know, people have never heard of muscle pain. They feel like I'm minimizing their pain. There's no way that these muscles could be causing this pain. And some of it is just the way that we're wired, right? I mean, it's kind of crazy that these muscles, if they're painful, can cause a lot of bladder symptoms, right? It just doesn't make sense to people, or, can cause different rectal symptoms. Even constipation and trouble pooping. I mean, there are so many things that can happen when those muscles are tight and uncomfortable, but nobody thinks about it and nobody has heard about it. And so it does take a while talking to people to be like, yeah, yeah, let's just try this. And then we can, come back and reevaluate if that's not right.
Yeah.
The other thing is, I mean, I think you know this, but pelvic floor physical therapy is not the easiest thing in the world to do, right? And a lot of people have a hard time, especially if you have a history of trauma. That can be just an impossible treatment for you. And so there are a lot of things to kind of think about and talk about. And one of the problems in medicine these days is everybody's just moving so quickly, and so it's hard to have that conversation sometimes.
Yeah, definitely. I would say it took me a while to come around, but what actually got everything for me to click was when my pelvic floor physical therapist sat me down and had a conversation with me going into the research and the science behind it, and showed me the model, showed me the diagrams. And then once I started going consistently and using a pelvic wand at home, I started getting relief within weeks, and I was
Yeah.
like, okay, well, here's my proof. Like, this was the problem.
Yeah. But it takes a little bit of time. It takes a little bit of education. And I think that's one of the benefits too of going to PT is a good PT is like a coach, right? You're seeing them regularly. They're talking you through things. And you never see your physician that frequently. And when you're working through something like this, I think PT is invaluable. But you have to be okay with PT and you have to be a believer. And sometimes it takes a while to get there.
Yeah, you definitely have to buy into it.
Hmm.
Um, okay, I don't know if this is a stupid question, but if somebody is on vaginal estrogen, does that have any effect on like the work someone's doing in pelvic PT? Like, can it help with that?
It can
Or-
help.
yeah.
It
Okay.
can absolutely help. And I'll tell you, sometimes I will get patients who are sent to me by a physical therapist, right? Where they say, we're making progress, but I think we would make more progress if there was vaginal estrogen on board. Um, PTs can't prescribe, and so then they'll send them to me for that, and I'll evaluate them. And I mean, I'll tell you, they're almost always right, right? I mean, they have such expertise in this area.
Yeah. No, that makes a lot of sense. I wanted to ask you because I've heard from certain people who've tried vaginal estrogen before, like an estradiol cream, if they have any sort of like burning that occurs or like a side effect, where do you go from there? What do you recommend from there?
Yeah. So some patients, so the estrogen that we usually give is the, FDA approved estrogen. And that estrogen cream has some chemicals in the product. So it's not really the estrogen so much, it's the base that they mix it with. And there's even a little bit of alcohol in that base. And some people are just so very, very sensitive to that. Most people don't notice it, but some people are really sensitive to that. So when that happens, then I'll have it compounded. And you can have it compounded for sensitive skin, and have them leave out all of those chemicals. And that almost always corrects it.
Okay. So there is another option that isn't something someone should just give up on just because they had that side effect.
No, I mean, it's not the estrogen, right? I mean, your ovaries make estrogen. Your body's had estrogen for, your entire, well, not your entire life, but, your entire reproductive life. So it's not the estrogen, but sometimes it's what we mix the estrogen with, right?
Hmm.
I mean, you could also try, the pill or the suppository or the ring, and that would improve things. But a lot of times we'll just compound the estrogen cream.
Okay. Got it. Is there anything else that people should know about vaginal estrogen? I'm trying to think of if there's anything I missed.
I think the big thing, well, so the other thing is that when you get a prescription for vaginal estrogen, the vaginal estrogen comes with a piece of paper that has all of the risks listed on it. And for vaginal estrogen, they have written down all of the risks that happen with any form of estrogen. So it includes the risks with oral estrogen and the estrogen patch, which actually is not the same for vaginal estrogen. Right. So you'll get this piece of paper and it'll have all of these risks on it about increased risk of clotting and stroke. And that actually does not apply to vaginal estrogen. At some point in time, we hope that they will change that. But I would tell you that that is terrifying for people, right? Because, usually I talk to patients, I, tell them the risk of vaginal estrogen, and then they go home and they get this piece of paper that completely disagrees with what I have said. And so that is really frightening. And it's just the company being as conservative as possible, right? And thinking listing more risks is good, but it's just terrifying for people. And so I'll frequently tell people not to read it. I don't know that that's really the right answer either, but that is the thing that I would tell you about vaginal estrogen. Um, the other thing that I would say is, and this is actually true for all medications, if your insurance doesn't cover your medication and you're looking for different ways to pay for it, you should always check out GoodRx, right? Which you can just do online, goodrx.com. And you can also look at Cost Plus Drugs, which carries most drugs at cost plus a $5 processing fee and a shipping fee. And so sometimes those two places are just so very, very much cheaper for you, that I think that's important to know.
Yeah,
So we
absolutely.
we have such a goofy system right now, and you have to know where the loopholes are.
It is crazy to me because I just feel like, okay, if there's a cheaper way to get this medication, like why is it not just like the go-to? Why do I have to bring up GoodRx at the pharmacy? Like it feels wrong.
I think that's fair, right? I mean, it is kind of a crazy system. You would think that, you would always be offered the cheapest way to get a medication, but unfortunately, that is not quite where we're at right now. So I always tell people to double check those things. I mean, it's interesting when you prescribe a medication because I frequently do not know how much it is going to cost somebody.
Hmm.
Right.
Yeah, that
So,
is crazy. But yeah, it's the reality of our country in the US right now. I
yep.
wonder what this looks like outside of the US. I mean, I know places like Canada might be a little easier, but I've heard that it's a lot harder to get into certain healthcare practitioners in Canada.
Yeah, I mean they definitely triage things, right? And so you are waiting longer to see a practitioner, but then things are much cheaper,
Hmm.
right? And
Okay.
so it's kind of, I mean, I think other countries are more comfortable waiting a little bit than we are. But I think at this point in time, there's so much frustration with our current system that I think a lot of people would pick to wait a little bit, um, and get, you know, care that seems more logical, right? Knowing how much something is going to cost, knowing when you're going to get in. So, and the reality is that wait times in the United States aren't low right now.
Hmm.
So,
Yeah.
I would
Okay.
make it better if I could, but I don't know the answer.
Yeah, you'd wave your magic wand. I get it.
I would totally wave my magic wand if I could figure it out. But I mean, there are so many things that we need to improve on just to improve the patient experience. I think one of the things in medicine that we don't pay enough attention to is the patient experience, right? And frequently that experience is not what you would pick.
Hmm. Yeah, I get that. Are there
Hmm.
any other myths about vaginal estrogen or like misconceptions that you wanted to address?
I think one of the things that people worry about is if they're using vaginal estrogen for whatever reason, and some of that estrogen gets on their male partner, what's going to happen, right? Will that have any negative effect? And I would say no, it won't, right? You should consider it to be lubricant. Um, so yeah, and you might waste some of it because it's not, staying where it needs to be. But that is something that people worry about all the time, right? If this gets on my partner, is he going to grow breasts? Is something going to happen? And that's not the case.
That's immediately where my brain went to. I could see my boyfriend asking that question.
Hmm. Well, and I think it's the kind of thing that people don't want to ask, right? And
Mhm.
you worry about that. Yeah. But I mean, it's external, it's topical, I, I don't know. You may not want me to say this. I think the other thing that people worry about is it going to make the penis shrink? Right? I mean, there are just so many things that people are afraid of, and that's not the case either.
I mean, I think those questions and fears are valid. I do
Oh,
understand that it might be
absolutely.
uncomfortable to ask, but yeah, I mean,
Well, and you don't want to do something, right? That I mean, what if that did happen, and what if it was a permanent effect, right? I mean, that's something that you would definitely want to know ahead of time. So yeah, and it's interesting because that form that you get with all of the complications listed on it, it would be nice if it was more practical, right? And it had the things that people really worry about.
yeah, there should be like an FAQ section.
Totally. Yeah,
Yeah.
absolutely. Because there are, I mean, these are questions that I get asked all the time, because it is a common concern, and people just don't know. So
Yeah. Yeah. No, I was just talking to my psychiatrist recently. We're switching one of the medications that I'm on, and she was telling me, this medication has this side effect. And I totally went down the rabbit hole of going on Reddit and getting my information from there. And then it got totally out of hand. And I was like, I should actually just take these questions back to the psychiatrist because she's probably the best source for me to get information from.
yeah, I think we all have that tendency, right? And you want to do your own research, and you want to look, and you want to ask about different things, right? You don't want to do something that you might regret, but then it's hard to put that information in context, right? And is the post that you're reading or the person that you're watching, are they the one person that had this incredibly rare complication that we really, happens 1 in 10,000? And so it's interesting because I think we all think more information is better, but sometimes it's just overwhelming and confusing, and it's hard to put it in the right boxes.
Yeah. Especially if you're someone with health anxiety or a tendency to
Yeah.
ruminate or catastrophize, which I know I am. So I get it.
But
I
I think
do.
that's common. I think a lot of people do that, right? And I think it's really common to do exactly what you said, right? Where you get the information and then you're going to go look at your favorite place, right? So Reddit or TikTok, whatever it is. And then you're going to get feedback that might be helpful to you, might not be helpful to you. It might not even be applicable to you, right? Because that person might have different risk factors. They might have a completely different health history. But those particulars aren't always discussed, and it's hard for you to figure it out.
Yeah.
So, and I think we're always afraid, right? That you're going to do the wrong thing and you're going to have that horrible complication, and it's going to be something that's not reversible. And
Right. There is a big fear element to it.
yeah, absolutely. I mean, we're all that way. And sometimes if you're seeing your physician and it's a quick appointment, right, you may feel like you didn't get all the information that you wanted, right? And so you're searching for more information.
Right.
So yeah. But a lot of times the things that are online are um sensational, right? I mean, people post things, they post the horrible things, the extreme things. I mean, I don't think most people post, "Hey, I took this medication and it was fine."
Yeah. I wanted to ask, are you getting a lot of people coming to you asking questions that are like, I saw this on TikTok or I saw this on Instagram? Like, are you getting concerns like that?
So I don't think most people say that, but you can tell what the current kind of trends are because people start coming in with the same question. And it's a question that, nobody asked 2 to 3 years ago, right?
Hmm. That makes sense.
So yeah, so you can definitely kind of tell what the trending things are. So a lot more people are asking about menopause and hormone replacement now, even at a very young age, because there's a lot of social media content on that.
Interesting. Okay.
It's hard. I mean, it makes it all a little bit more challenging, I think. And for me, there's also a lot on social media about how your doctor's trying to gaslight you, right? There's always all of those stories, and so that means that we start the relationship with more distrust than ever before. Um, yeah, and so that can be challenging too.
That is interesting to hear from like a physician's perspective. Like you might have to tweak your approach a little bit versus what you would have done 5 to 10 years ago.
Well, so I would tell you when I first started my career, patients would be sent to me by their very beloved gynecologist or primary care doctor, right? And so because they really liked and trusted that person, they liked and trusted me, right? It was just kind of an extension. And that's different now. You get more patients from reviews and online, but that trust factor is a little bit different, and so you're starting at a different place than you did before.
Yeah.
So
Sign of the times.
yeah, I mean, it's just different. It is what it is.
Yeah,
But figuring out how to get that person comfortable and to trust the system. I mean, it takes more touches than it used to, I think.
definitely. Okay. Well, is there anything else you wanted to discuss on the topic of vaginal estrogen? Any final words, pieces of advice?
Yeah, I think that it's for many people, it's a reasonable thing to try. It's low risk. Um, you know, you would try it for a finite piece of time, right? And if it worked, great. And if it didn't work, then you're going to move on to other things. And then for a lot of patients or a lot of women, it is one piece of the puzzle, right? So it will improve some things. It may not make everything better, but it can improve a lot of symptoms. So, and I guess the other thing that I would say is, if you're someone who feels like you're getting recurrent urinary tract infections, but your cultures are always negative and but you have those symptoms, that is frequently low estrogen, and vaginal estrogen can be really helpful in that situation.
Would that apply to people like my age, like 30s, maybe younger?
I mean, it can, right?
Okay.
Depending on what else is going on, depending on medications and birth control, and if you're where you are in pregnancy and fertility. So
Okay.
it definitely can. I think the thing about low estrogen is that I think it's pretty common to think, oh, my estrogen's going to get low when I'm 50, right? But it can happen much younger than that, and it's not always on your radar.
Hmm. Yeah.
So, and some of those reasons are reversible, right? I mean, sometimes I have patients who are young and breastfeeding and having a lot of symptoms because of low estrogen, and during that period, we'll just use some vaginal estrogen to improve things. So, and then once their hormonal levels get back to normal, they don't need it anymore.
Okay. That's a good point to bring up. Is like this doesn't necessarily have to be a long-term thing that people need to be on.
No, not at all. I mean, and that's a common question that patients will ask, right? I mean, someone will come in and they'll say, I'm having these symptoms. We put them on vaginal estrogen, they get a lot better. And then they say, do I have to do this for the rest of my life? And no, I mean, you can stop at any point and then kind of reassess and see what happens. And then if you feel better on it, you can go back on it. Um, right. I mean, there's no problem with that. I think a lot of times taking a drug holiday, right, with your physician's approval, don't just stop things, but taking a drug holiday to see if that drug is really helping you and if you still need it, it can be a really good idea, because sometimes over time you just get put on more and more things that may or may not be helping you as much as you want them to. So. I mean, some women love vaginal estrogen and never ever want to come off of it. Some people, they don't see enough of an improvement to warrant continuing to take it.
Okay. Makes sense. All
Yep.
right. Well, I feel like this has been a really informational episode. I learned a lot. I hope my listeners did as well. If anybody is in Oregon, are you accepting new clients or
Oh
patients?
yeah.
Sorry.
Mhm. Sure.
Okay, awesome. Well, I
Same thing to
can
me.
link
Yeah.
that. Yeah, I can
Okay.
link that in the show notes, and I'll also link your social media account. Also,
Yep.
Sarah has a podcast. If you want to say the name of it, feel free.
It is called While You Wait. So I started my podcast when I had a very long waiting list, and a couple of my friends who are primary care doctors said, can you help our patients with some information before they get in? And that's kind of how it started. And it's, grown into some different topics, but it's really just to educate women on urinary incontinence and the pelvic floor and different things that you can do, right? Because I think, education is half the battle.
Definitely. I love that you're doing that. And we will for sure link that in the show notes as well. So I just wanted to say thank you so much for coming on and sharing your knowledge with my community.
Yeah, yeah, it was fun. I'm happy to do it. Happy to do it again if you have anything you're interested in. And, good luck to everybody on your healthcare journey.
Thank you.